this part of our week. Happy Wednesday, everyone. This part of our week is a typical study session, which may seem like, yeah, we're just talking about TPN, but actually, this is a major part of our journey to our training to be great nurses in the future. So what we're doing today is certainly going to impact our future in nursing. So we are getting ready for the NCLEX. We are going to be working from this book right here. This is the V2 student workbook. You're in my program. You have this book, whether it is the physical, and I usually don't have this one, but everybody gets the downloadable V2 workbook from your file vault. If this is your first time joining me, my name is Professor Regina. I am the leader of the ReMar nurses. It is my pleasure to be presenting this topic on this evening. Hey, everybody. All right. So TPN, let's talk about it. As always, if you hear me mentioning something like ReMar V2, this is the name of my platform where all of the good lectures that I have prepared for you are residing. I call it V2 because it is the virtual trainer. It is where the second version of next gen training takes place. So every testimonial that you see from ReMar, it is from nursing students who have committed to doing my full program, watching these very short videos, short but powerful. I say short but powerful because the time that it takes you to prepare for the exam should really be focused on the things that matter, There are a lot of subjects that we cover in nursing school that will never be on your NCLEX exam. So I want to make sure that you are not studying the things that will never be on the exam, but study the things that actually are. TPN is one of those things. Why? Because it is a very serious intervention. And if you are caring for a patient who is receiving TPN, you better know why. You better know what complications, and you better know, most importantly, your priority of nursing care. So let's get into it, everybody. Hey, come on in. Happy Wednesday. Total Parenteral Nutrition. We're going to call it TPN from now on. I'm not going to say that anymore. TPN, it is a method of administration of essential nutrients, right, to the body. Check this out, through a central vein. Now, this is a very starting and very important point for our understanding of TPN, because normally when a patient is eating, they are making use of the digestive tract. However, in this situation, we are feeding our patients through their veins, which who even knew that was possible? Shout out to modern medicine. But there are serious consequences when we divert food from where it's supposed to be and put it inside of our veins. What? We're going to put food in our veins? We're going to put nutrition in our veins? Yeah, that's TPN. So parenteral nutrition is given through the IV. TPN is adequate because it will supply all of your daily nutritional requirements. So that is what makes TPN quite popular, is because a patient can be on TPN and not have the effects of malnourishment, meaning you can put protein in TPN. You can put amino acids, you can put carbohydrates, you can put fats. All of these things can be mixed into a TPN solution, and your patient can nutritionally be supplied. Okay. You may see when you are learning about TPN that some may say, well, you can give TPN through a central line or a peripheral line, meaning you can use a big vein or a small vein for TPN. Typically, you will see TPN given through a central line. Why is that? Why is TPN better when it is given through a central line? Come on in, everybody. I see I have Texas in the house. I love this international study group here. We are all on a journey. You're not alone when it comes to preparing for NCLEX. Even though you're probably the only one in your home studying, when you come to class, you'll see hundreds of other ReMar nurses who are also here. Canada in the house, Maryland. So I'm asking the question why the central line is going to be more appropriate, more beneficial to our patient. Well, the central line is more appropriate because, number one, the vein will have less irritation when it is bigger. All right. The patient will receive a dilution more quickly. It will be easier to manage. Oh, I like that. Yeah, so there are benefits to using the central line. It is going to last longer. It is going to last longer than a peripheral line receiving TPN. Good job. Wow. We have somebody here from South Africa. We have somebody here from Michigan. This is phenomenal. This is phenomenal. Alabama, I see you. So TPN, it should not be used for anyone who has an intact gastrointestinal tract, meaning this is never a first consideration. This is usually a last resort. We do not want to give, if there's even the smallest amount of chance that a patient can eat naturally, we want to give that patient the ability to do that, because the disadvantages of the parenteral nutrition are severe. There are no small ones. There are no tiny consequences. They are all big. And NCLEX wants you to be aware of that. There are more complications. Okay. The GI tract, it begins to have issues because it's not being utilized. So yes, sometimes we want to use TPN for bowel rest, but there is even consequences of bowel rest. Did you know that? Yes, there's even consequences of resting the bowels. It is more expensive. TPN is very expensive. That solution is not cheap. Total Parenteral Nutrition. So I have here, what is the reason why? What is the indication for TPN? Some people may want to know, why would somebody need to have nutrition given through their veins? Well, it's very, very interesting. All right. And anytime you're not able to consume your nutrients through your normal digestive tract, then you will need another route, because if not, you will become malnourished and you will have electrolyte issues, and you'll have bigger problems. Ulcerative colitis. Make sure you understand the principles of ulcerative colitis in terms of what is the clinical presentation, and absolutely know what makes it better, what makes it worse. Okay. Anyone who has a congenital GI anomaly, these patients, very young, would be given TPN. Bowel obstruction is another reason, and short bowel syndrome. What is short bowel syndrome? If a patient has short bowel syndrome, do they have an issue with their large intestine or small intestine? What does that mean? And remember this, when you're studying right now, and you come across something and you're not 100% sure what it is, take time to stop and look it up. And that's why it takes me so long to study, because I do that all the time. If I see a word and I can't, what does ulcerative mean? What does colitis mean? If something has colitis or is colitis, what is that? Short bowel syndrome. What is it? What is it? Is it literally a short bowel? No, it's not that. Right? What it means is that the patient in their small intestine is not able to absorb nutrients. And so this is something that would require another route of feeding. Okay. So think about that. I have here, besides the GI tract, because I said that, already, the intestines. What other organs, if they are abnormal, would require the patient to have TPN? Give me another one. Is there another one that you can think of? Small intestine, large intestine, yeah. But there's something, what other one that I want to see here that we would have to perhaps give the patient TPN? Oh, how am I saying? The liver, kidney. I like it. People are like, I don't know. Okay, so we have here stomach. Okay, stomach. I'll take that one. What else? The pancreas. Okay, the pancreas as well. If a patient needs to have rest for their pancreas, then sometimes TPN, if they're having some sort of malfunction with their pancreas, sometimes TPN can be involved. It is very interesting when we are dealing with the indications for TPN, right? And so the doctors make these calls. We as nurses have to understand why. Why is my patient on TPN? And what am I supposed to do about it? Very good, very good. You guys know I have the questions coming up about this subject. So complications, the reason why TPN is considered that last resort is because if you are putting a central line in a patient, this puts them at risk for some things, okay? Catheter related sepsis, of course, this is huge. This is huge. If a patient gets a sepsis in the central line, that's directly into their bloodstream. What other issues can a patient have? There's one that I go over specifically in this one here. When you're inserting a central line, what can you cause a patient to have? Not you specifically, but a healthcare provider. If they're doing a central line, what can their patient develop because of that central line? I'm looking for it. Yes. Okay. So I'll take embolism. I'll take embolism. There's something else I was looking for though, specifically. It has to do with inserting a central line. Any patient that is given a central line. Okay. So embolism, hematoma. All right. Okay. Oh, good, guys. All right. I want to go on to this to talk about the complications, because there are actually many complications with TPN. We know that if we give a patient TPN, they may come out sicker than when they started. We don't know, right? Because of the complications. But I want to add to the chat. I love when we do this. We have ReMar nurses and we add them to the chat. Hey there.
Hi.
How are you?
Hi, Professor Regina.
How are you?
Hi, ReMar family. Oh my God.
Woo! You're in. So I added you to the study group.
Yes,
How do you want to talk to the ReMar nurses? Just coming your own way.
I took the test on last Friday, July 12th. Okay. I found out Monday that I passed. And oh my God, ReMar, it's like you gave me a lifeline, because I tried so many other things. I was in a review class in the beginning of the year that started. I paid money for it, so I couldn't get out of it. I'm looking like, okay, but this is a lot of information. He used this thick book. I'm looking like, oh my God, okay, overwhelming. But I went through UWorld, Archer, Simple Nursing. I paid for that subscription, and I had to finish that. I'm looking like, oh my God, what am I going to do?
Yeah.
You popped up into my news feed on Facebook several times. I bought Quick Facts, and honestly, it sat on my shelf until I got done with the review class. So I'm looking like, oh, okay. I need something. I had no structure. I had no idea what I was going to do.
Yeah.
I did the free trial and I'm like, okay, here we go.
Mm-hmm.
I finished the free trial within a couple of days and I'm looking like, okay, well, I need more. What am I gonna do?
Yeah.
I kept going to the Monday motivationals, winning Wednesdays. I've done RNU. I did Nurses Week. I mean, I have all my stuff.
You do. Check
And
that out, everybody.
it's like, dude, it was like a light that was like, oh, because
Mm.
everything was so structured. That's what I needed. And
Gotcha.
when I got into V2 and upgraded, I was like, oh my God, are you kidding me? And I didn't know how to use the question bank at first. I just kept hitting and watching all my videos. I finished the videos all in 2 weeks. So that's
Wow.
I upgraded May 10th. I finished the videos 2 weeks later, and I was on my second go round in V2. So
Yeah.
I just kept going over and over and over. Uh, I decided to print out my V2 because I didn't want to mess up my pretty book. So I wrote everywhere all over this one, color
No
coded.
way.
And I'm looking like, dude, I had it all sitting. And I'm like, no. Okay. We get the quick facts. I use my quick facts. I watch your videos on YouTube and I have all my notes that wasn't filled in with quick facts. So I'm
Nice.
like, okay, all right. I'm here. I'm
This is
there.
the work. Yeah.
There. This.
This is the work.
Oh my God. I mean,
Yeah.
I want to thank you so much for saving. I am a repeat test taker. I have been out of the field for over 10 years. So
Wow.
10 years plus. I ended up having to retake the NCLEX because the board said I needed to. And I'm
Okay.
like, okay.
Wow.
I was not ready for that, but I'm like, okay, let's go.
What state is that? What state
I'm in
made you take the exam?
California, Los Angeles, California. So that's the state board is
Wow.
Sacramento. And I'm like, okay, yeah, we're gonna do this. I'm gonna stay steadfast and do what I need to do. And ReMar, oh my God, Professor Regina and your husband Mark, you guys are such a blessing. And when I seen that you had a face like me,
Yeah.
as far as skin color,
Yeah, for
you
sure.
don't see nothing on the planet that has our skin color on doing this.
It's true. It's true.
And
There's no
I'm
lie. There's no
looking
lie.
like, oh my God, this right here, I was sold. My daughter is like, well, what are you doing? My husband, what are you doing? You're up, you're still, look here, leave me alone. Let me do my thing.
For
Yeah,
sure.
that part. Professor Regina, that's all they heard. My quick facts. My husband was repeating um, the eye drops from the video. He's like, well, why aren't you supposed to put the lid down? I'm looking like, look who was listening.
I
Okay,
love
what
it.
the heck?
Anybody can understand it.
That part right there. And it is so easy, you guys. If I don't say anything else, content, content, content,
Yeah.
quick facts, content. You know, I was blue in the face with my V2. I went through my V2 like 3 times before I took the test.
Talk to me about taking the test. What was it like for you to take NCLEX after being out of school? What was it like?
Very intimidating.
For sure.
because when I took the test, I had a pencil and a piece of paper. It was not a computer. And everything that you provide for us, I had to know. So everything like easy labs, electrolytes, and numbers, and knowing certain medications, certain classes of medication, I had to know that stuff. Because if you didn't know it, you didn't pass. And I did pass. So, you know, it was intimidating. But when I sat down, I put on my board, I can, I will, I must pass NCLEX. And that's the first thing that I wrote on the board. And the lady looking at me like, okay, what the heck are you doing?
Like, what is that even?
Like, don't worry about it. I already know. We channeled here. I got this. But I took 150 questions.
You went the whole thing. Wow.
I struggled. I mean, I didn't know if I was answering the stuff right or if I was getting it wrong, because it seemed like they kept asking me the same thing over and over again, but wording it differently. And I'm thinking like, oh my God. When I got to question 96, I panicked. I was like, oh my God. Okay. I'm looking at the computer. I'm like, oh my God. Okay. Wait a minute. It's still going. I'm like, oh. So I had to center myself and say, I'm still in this game. And I kind of like had you in my ear. It's like, I can hear you when I'm sleeping. I mean, it's kind of weird, but I'll go to sleep listening to the lectures. And I'm like, oh, okay, I got this.
You're in it. You're in it. You're in it. That's how I know you're in it. Can you talk about your study process when you're sitting in an NCLEX review and you're getting the information? You're getting information, but it's not connecting. What do you tell yourself in that moment to understand, like, okay, I need to do something different, or I need to do something more? Like, what is that? What is that?
For me, like you said, we have to horn into what kind of learner we are. And I noticed that if I watch a YouTube video and then I have my quick facts next to me, I'm like, okay, this is confirmation that I need to know this. And writing it down is like, okay, that was the perfect combo. And the other review classes and the other things, I had no other word to go. One class, all he did was lecture, and that's it. We didn't have no visuals, no nothing. So I'm looking like I'm writing notes down, but I had nothing physical, tangible for me to touch or look at.
Yeah.
So I'm looking like, okay, that's kind of weird, but all right. Simple nursing, they have that visual stuff going on, but it's too much. And it's like, all right, ReMar, we are straight and to the point. This is what you need to know, and make sure you remember it. So that combination, along with the videos, and if I didn't understand something, I'm going back over the video.
Yeah.
If I had to go over it 10 times, I'm going back. I'm stopping, pushing pause. Okay, is this what she said? That part.
So, that part. Yeah, writing it down. Yeah. Yes. Yeah, I understand the type of learner you are. It seems like we're similar. I need to be able to do all three to remember. So now that you have passed your NCLEX, what is next? Hi, husband. Is that the husband in the back?
Yeah.
Hey, awesome. That's so awesome. What's next for you?
Next, I'm not sure. I want to probably work in mental health to start off.
Wow.
I don't know. I don't know what's out there. So I'm still in the investigation mode. Like, what can I do?
Yeah.
So
Yeah. Yeah.
yeah, I, I'm
Okay.
I'm drawn to mental health and convalescing and stuff like that.
Wow. Listen, there are so many opportunities actually for you in that field. That field is wide open. Is wide open. So, congratulations for doing the work when the
Thank
exam
you.
was difficult, keeping yourself in the game,
Thank you.
studying. You seem like you did everything plus more that you were required to do. You had to take the NCLEX twice out, like shout out to you for having to go through it. I always say, and so you proved me wrong because I always say once you take this test, you never have to take it again.
Man,
So
that
you
part. Yeah,
yeah,
that was a little crazy. I'm looking at the state board like, are you sure?
wow.
Okay, all right.
You
But I
taught
got
us something today.
you.
You taught us something today.
Yeah,
Man,
man. Thank you so much, and God bless you and your family. God bless ReMar family. Everybody that are here tonight. Do not give up.
yes.
Do
Yes.
not give up. All I could say was, peace, be still. I
Mhm.
had to be still to let that peace move me. And it moved me in the test and I passed. There you go.
Wow. Wow.
There,
Wow. Wow. Thank you so much for this amazing journey that you have been on and share it with us. And thank you for
thank
allowing me
you.
to be part of it. I know
Thank
you had a lot of
you.
different choices. I know you had
Oh
a
my
lot of different
God. I'm
choices.
just like starstruck. Like, I know my daughter is upstairs yelling and screaming because I told her to get on the line.
Yeah, no, you're the star. You're the star today. You're the star. You are a perfect example of a ReMar nurse. I want everybody watching, I want them when they get discouraged or don't feel like they can do it, I want them to think of you. I want them to think of
Man,
this nurse Pittman, whoever she was. We know she's in California, but we know she did it. She went
that
through the
part.
whole exam, and
And
you are like,
I'm still here. You know, it's like I can't let you go. So I'm always at the winning Wednesdays, the motivational Mondays, and until I start working. So yes, I will be here.
absolutely tap in. You should be a ReMar rep too. You ready to be a
Okay.
ReMar rep?
Hey, I'm gonna work on that.
All
I'll,
right. Thank you so
thank
much for coming to Winning Wednesdays. I love your testimonial. I love everything
you.
about what you shared with us and your realness. I can tell that you're like a real person. You're going to keep it real. You're going to keep it real with us.
Yes,
So
ma'am. Yes, ma'am.
anytime I see you, I'm going to shout you out. Thank you so much for joining.
Thank you. You guys have a good one. Bye.
What a good night, you guys. And what I love about Nurse Pittman, she dropped something. She dropped a real jewel on everybody today. And I don't know if you realize what it was, but she essentially demonstrated that there is a difference between information and revelation. Did you catch that? You can have a lot of information, but if you are not understanding it to where it makes a connection and you have a revelation that, oh, this is this, or this connects with this, particularly when it comes to NCLEX, you will not get the results that you are looking for. And that's the trick. That's the trick. And that's why you can go to 100 different YouTube channels for NCLEX, and they're all doing lives. Everybody's doing this right now. Everybody's doing lives. They get on, they spend 2 hours with you, 3 hours with you. Today we're going to talk about this, whatever. And people show up and people are there. The problem is there's nothing to put it into. There's no foundation. There's no program that you are saying this is connecting with this. They're essentially just wasting your time. That's what I want to say. They're essentially just giving you things knowing that you don't have anywhere to put it. You don't have nowhere to put it, right? So what I'm trying to train us to do on Mondays and Wednesdays is say, I'm trying to get you to say, yes, this, what we're doing here belongs from here. Like it goes with here, or it goes here. You put it together so that you get a revelation. I'm not just trying to give you information. You can get that anywhere. You can open up a Saunders book. You get 1,000 pages of information, right? If you don't understand it, if you have no revelation, if you're not changed after it, then you've essentially just given them attention and wasted your time, right? And so that's how you can do a whole bunch of studying, spend a whole bunch of money, go to a whole bunch of different classes and not pass. That's how it is. Okay, let's get back into it. So what we're talking about here, we were talking about TPN. We were talking about the reasons for it, the organs that are involved, that are abnormal. And then we're talking about the complications. So the first one we had talked about was sepsis-related catheter infections. I also said you can get an embolism, infection, right? Also a complication is you will have abnormal electrolytes and mineral levels, and most particularly the one I started with, which is glucose, because TPN has a dextrose base. Dextrose base means it's sugar. It's sugar. So one of the big things NCLEX wants you to connect TPN with is hyperglycemia. Okay. Hepatic complications. This is the one I talk about so often, especially in the V2, is that TPN is great, but it is very hard on the liver because the liver is not supposed to come in contact with nutrition in that way. So you will have liver dysfunction, hepatomegaly. Your liver will suffer. Means that, in general, you will not be a healthy person. You will not live very long if you are on TPN. It is strictly for short-term use only. It can also affect your bones, metabolic bone disease. You can have an adverse reaction to the lipids that you are coming in contact with. And it can also cause cholecystitis. It's interesting because when you are resting the bowels, you also can rest bile. And that means that bile is not moving in the way that it should be moving. And so you have gallbladder complications as well. So add those to TPN, which is on page, usually we do this early on. Usually you guys will say what TPN is on in the workbook. We are talking TPN. Why can't I find it? 45. So our nursing responsibilities, before we get into these questions, I have 3 questions. We want to obtain a complete history of the client. Always want to do that before TPN is started, with the physician doing the physical examination, also assessing any present or history nutritional deficits, such as inadequate oral intake. Because if you are starting TPN off and your patient already has an electrolyte imbalance, that TPN solution should be modified to address those conditions. Dehydration, your patient has hyponatremia, those kind of things. Again, the labs that we are presented with on NCLEX serve a purpose. The labs of your patient tell you very much what the organs are going to be doing or what they are currently doing. So if our patient has an abnormal protein level, if their BUN and creatinine is abnormal, we need to be able to interpret laboratory values like it is a second language, because it is. CBCs, lipid profile, and iron levels. Monitor our patient's vital signs. We are always using strict aseptic technique, monitoring blood glucose levels, and monitoring signs of fluid overload. So TPN, this is a quick review of it, but these are the facts that you should be taking to your study sessions. Monitoring renal function, maintaining and ensuring that TPN is always on an infusion pump. We never run TPN to gravity. You can run IV fluids to gravity, but you never want to run TPN to gravity. And also, this is like a huge point, we don't want to ever abruptly stop TPN. How should we stop TPN? Somebody put it in the comments. I'll spotlight it if you know TPN It's kind of like the same principle with steroid therapy. Okay, put it in the comments. And again, like I said, information means nothing if you don't have a revelation based on a system. There you go. Taper off TPN, taper off TPN. Good job. Gradually weaning. That's right. Our study session, our study group tonight is studying. And so that is what I want you to move into, understanding that the process of learning can be shortened when you have a foundation, So V2, get in the free trial, just like Nurse Pittman did. She started at the free trial of V2 and she was able to see the difference in her learning. She was able to see the difference in how much she understood in just that first session. So in the free trial, you'll do maternity, you'll do developmental milestones, and infant heart defects. I think those are all in the free trial, plus take a couple of quizzes. So tap into it. There may be a coupon code floating around if you want to upgrade as well. Okay, it's time for the NCLEX questions. And these questions, they help you to estimate, am I doing what I'm supposed to be doing? Do I know what I'm supposed to know? So there's 3 questions. The challenge for you is 2 out of 3. 2 out of 3. You ready? Let's go. Okay. Question number 1. A nurse is caring for a client with bowel obstruction who receives a TPN through central venous catheter. Okay. And they're on an antibiotic treatment. Which initial action would the nurse implement before administering the antibiotics? Number 1, stop the TPN. 2, check compatibility with TPN. 3, ensure a separate IV access for the antibiotics. Or 4, flush the IV access with saline. You have a patient and they are getting TPN and they're getting an antibiotic. What's the initial action you do? Okay, number 1, stop that TPN. 2, check compatibility with TPN. 3, ensure separate IV access for antibiotics. Or 4, flush the IV access with saline. Okay, people are saying 2, some people are saying 3. Ooh, so we got it down to 2. Is it 2 or is it 3? Is it 2 or is it 3? Correct answer, you got to know this, okay? It is 3. TPN is never, you never give anything in the same line that your TPN is running in, okay? You never mix TPN with anything else. And NCLEX will present other things, antibiotics. It could be antibiotics, it could be blood, it could be anything. Okay, just know TPN always has its own dedicated line. Very, very important. All right, so ensuring separate IV access for antibiotics to prevent crystallization in the CVC tubing and disruption of the TPN infusion. TPN is only used for TPN. Okay, all right, I'm moving on. Most of us got this one right, but there were some who picked number 2, checking compatibility with TPN. Doesn't matter, okay? Usually you don't have to worry about that because it's given in a separate line, okay? So let me move on. Number 2 is this. The nurse is, hold on one second. Let me make sure I got this one right. Okay, I'm gonna give it to you guys. This one is, all right, I don't like this question, but I'm gonna give it to y'all anyway. Nurse Joe is teaching a practical nurse that one complication of a client receiving TPN is number 1, thinning of blood. 2, catheter-related sepsis. 3, teeth staining. 4, growth retardation. Which one? And I saw this one. I saw this one and I meant to change it and I didn't change it. I didn't like it when I put it on here. Of course, it's too easy. Y'all knew what it was. I meant to change this one. I don't like when it's easy like this. I want y'all to be thinking and squirming. Yeah. And I told you the answer too. That's the thing too. That's what it was. Sometimes I write the questions and then I'll go over the slides and then I forget, like, I'm going to tell them this answer. Oh, it's number 2. Y'all knew that. Catheter related sepsis. All right. Too easy. Of course. Number 3, I'm moving on. I didn't tell you this one. Okay. A patient receiving total parenteral nutrition, I said it, via a central line and insulin, they're receiving TPN and insulin, reports a headache and feels weird. What is the highest nursing priority here? Number 1, assess blood glucose levels. 2, administer a dose of acetaminophen for the headache. 3, stop the TPN infusion and notify the healthcare provider. Or 4, check the patient's electrolyte levels. What do we do here? Listen to this. The patient they are getting TPN and insulin and they have a headache and they feel weird. Yeah. What is the highest nursing priority? The highest nursing priority. Correct answer. I cannot believe it's over 900 people studying on Wednesday. That is so record breaking. If we were all in one building, you know how loud we would be? So loud. I love it. Okay, correct answer. If you chose number 1, you got this one right. In this scenario, remember, I tell you, look for the answer in the question. We know the patient is getting insulin and they have a central line. This is dextrose based. So if they're feeling weird, we need to know more information. We need to assess them before calling the doctor. So we have to definitely call. We have to assess before we call. Okay, how did you do? I said do 2 out of 3. Some people got 3 out of 3. Very good. 3 out of 3. This episode was absolutely brought to you by the V2. Don't forget this. Don't sleep on this, okay? If people asked you, what is the best NCLEX review on the planet? You got to say the V2. Most people are not familiar with V2. And when they come in contact with it, they say, yo, this is so sweet. If you have the program, remember, you should be studying from your blue book, okay? Whether it's downloadable or you had me send it to you, the quick facts, and also in those videos, get in the V2 and watch those videos. You can watch my videos, guys. You're able to watch those videos even if you are, if you're washing your clothes, let me put that, if you're washing dishes, if you're following your calendar, remember the calendar is in the file vault. So every time you sit down to study with V2, you are watching, you are reading, and you are answering something. This is how you make sure you get through the program. You can get through the program in 2 weeks, in 3 weeks, if you are doing one study session a day, okay? This is the difference than just having a whole bunch of different YouTube videos that you're watching. I know some of y'all like to just watch random YouTube videos, but you should really be working within a system, okay? You should really be working within a system. So again, like I said, whether you have this book or this one, if you printed it out like I did here, or if I sent it to you, this is where you are watching those lectures and taking those notes, okay? I'm going to show you really quickly how to get to that study calendar if you don't know. Let me go back to the V2. So this, when you first log into V2, you will come to this page right here. Remember, everything about V2 is controlled on this side panel. So this is where you have the videos. This is where the question bank is. This is the file vault. You can take notes. How many people use the My Notes section? How many people are actually creating notes and taking notes? How many people do this? Did I develop this for no reason, or are we actually doing notes here. Because when you do these notes, you can absolutely save them, print them out, all those things. Let me know if you're using my notes. And then the setting is where you can change everything. Okay. So anyways, I was talking about where you go for the file, the calendar. So if you go to File Vault and you click on File Vault, everything is downloaded as a PDF. So you definitely want to have a PDF reader. If you don't have a PDF reader, then you might have trouble downloading these files. So make sure you have one, or wherever you're downloading it to has one. The daily study calendar is the first thing. It is the very first thing here. So you can click on daily study calendar, and where it says download files, this blue area. Okay. This blue area right here, if you click this blue arrow, it will download it. Okay. It will download it, and then you're able to, again, this is something you can print out. This is something you can print out. So if you have not explored the File Vault in V2, it's under course resources, whether you're a registered nurse or a practical nurse, there are some things that will support your learning, especially if you're somebody that likes to print out papers and write things. There's practice questions on paper for my traditional nurses who like to do paper tests. There's paper quizzes there as well. Okay. And I see your comments that you guys are not using that notes section. That's good to know. That's good to know. All right. So I hope you guys enjoyed the class today. Winning Wednesday, we talked about TPN. Very important. The safety points are there. And you are following your calendar. You're following your calendar so the connections that need to take place can take place. The daily study calendar will also tell you when to go into the question bank of V2. V2 has literally everything, all of these things that are necessary to pass the next gen NCLEX, the lectures. It has CAT exams, questions, and the physical book. Okay. All right. As well as the daily study schedule that is going to help you stay on track. Hey, I'll be back again on Monday. You have achieved Winning Wednesday class attendance. That's major. I know you have so much going on. So just pausing and dedicating one day out the week, or 2 days if you come on Monday, is a big, big deal. Also, I saw that I have some people from Africa who are watching, and you also want to join. Don't forget our nursing partners in Africa, Kenyan Nurse Consultants. They are ready to help you onboard to V2. They will talk you through it so that you understand. They'll make sure that you get your books quickly, very, very quickly. Screenshot this so you can reach out to them. We are going to train every nurse in Africa for the NCLEX. It is so, so important and vital that you all have your U.S. license. If you intend to come to the U.S., ReMar Review is going to train you to pass the NCLEX. So I'm really excited about that. I will be back on Monday at noon Eastern time. And what else do I have to say about that? Yeah, I'm looking forward to it. All right. If nobody told you this, or if you are taking your NCLEX and they hand you a whiteboard to write something down on, guess what we're writing down? We decided this. We decided this not too long ago. Everybody, when you get that board, you are supposed to write down what? Not laboratory values. We don't need those anymore. You're not supposed to write down your favorite food or medications. You are supposed to write down this. Because at this point, if you don't know it, right? Let me tell you this. Whatever you don't know, when you take your NCLEX exam, you're just not going to know. Okay. So if you have not memorized all of the atypical psychiatric medications, don't write them down. Don't write them down. Okay. Forget that. We got to go in there. We got to take this test like a man, or we got to take this test like a woman. Okay. And we're going to write down, I can, I will, I must pass NCLEX. Because you're going to see something on that exam that you never seen before. You're going to look over on your whiteboard and you're going to be like, okay, I didn't even write down this medication. I never even heard of this before. So if you look on your whiteboard and you see I can, I will, I must pass NCLEX, then you're going to be like, okay, let me stay back in the game. Let me get back in the game. Okay. That's the thing. Okay. You can put it in Jesus' name. We want to add maybe at the bottom, put like in Jesus' name, because that might help us too. Right. We have to go in there with a mentality that I'm not leaving without this license. Right. There might be some other people in here that are going to leave without having a license, but I'm not one of them because I've been trained for this type of, I've been trained for this battle. Like David beat Goliath. I'm going to beat the NCLEX. There's just this is a giant, but this is not the biggest giant in my life. Some of us have already overcome things bigger than the NCLEX. So we are certainly not about to fall to the NCLEX. It's I can, I will, I must pass NCLEX because the Lord fights my battles. And so nothing that man has created is going to close a door that is meant to be open, right? And that is kind of how you have to walk into this exam, because the pressure of the exam will make other people fold. People will fold because of just the sheer pressure of this exam, the magnitude. And honestly, they want it like that. They want you to be scared when you come in. They want you to be intimidated. They want you to feel like, oh my goodness, this is the biggest test of my life, right? They want you to feel like that because the money that is made when people have to come back and retest and retest and retest. Oh man, they sitting like fat cats when people are not able to position themselves for battle, right? And so we're not going to be paying more money for this experience. There are people that literally pay thousands of dollars for this experience. That's not going to be us. We're going to give them that first, whatever that little $200 is, we're going to give them that. But that's all we giving them. That's all we giving them. Okay. You got your nursing shoes already. I can, I will, I must. That's the goal. In Jesus' name. We're going to write it down. I can, I will, I must pass NCLEX. See you guys later. Bye-bye.